welcome to the COVID Advocacy Exchange. I'm Dave Fuhrer, CEO of Grit Health. If you're here with us, you care deeply about something. You are relentless in the face of impossible or uncertain times. If it's okay, I'd like to share with you what I'm passionate about and what my purpose is before we get started. In my 20s, I was diagnosed with cancer twice. As I was recovering from my second cancer diagnosis, my dad was diagnosed with bladder cancer and he passed away. That moment was more impossible of a time in life than I ever knew impossible could feel. In 2012, I left my career, the career I thought I was building, to become an advocate. I remember this overwhelming sense when I first joined Advocacy of wondering what I could do to make a difference, of wondering what I could do that wasn't already being done, and most of all, wondering how one person could make a difference. As I sit here today, 8 years later, I've never been more proud of what I've been able to do in advocacy and what I've been able to be a part of with you as our fellow advocates. We care deeply about big problems. We care deeply about solving challenging issues, and we care deeply about elevating humanity. This advocacy exchange is all about that. It's about bringing us together around the world to deal with the specific and individual issues we're facing as advocates and to deal with the collective ways we can move forward through COVID. Over the next weeks and months, we will bring together every week advocate leaders from different areas so we can collaborate across advocacy communities and disease and conditions. During these past few weeks, I've had conversations now with more than 50 of you, hearing how you're affected, hearing how the work you're doing is challenged. The stories you've shared and the things I've been able to share give me hope that regardless of how challenging this moment is, we will get through, we will prevail, and we will look back and feel proud. In just a moment, I have the honor of introducing Cathy Traz, the head of global advocacy for Bristol-Myers Squibb. Before I introduce Cathy to welcome everybody and to kick off this program, I want to say thank you to our team. They are the heart of our grit and everything that makes this possible. I want to say thank you to you for joining us, for inspiring others, and for solving problems. I encourage you, after the live session ends today, to get familiar with this virtual conference that we're in now. You can explore the lobby area, you can check out the exhibitor booths. There is a ton of content from some of the organizations that I respect most in the world. It's all interactive and it's all there for you to get familiar. Each week, each Thursday, we will bring together leaders to tackle specific topics, to collaborate, and to move forward together. I want to thank Bristol-Myers Squibb for believing in advocates and believing in advocacy, for making this possible, and for dreaming big. With that, I have the honor of introducing Cathy Traz. I encourage everyone to make comments, share stories, and be a part of this as we go forward. Thank you, everyone. Cathy, I'm honored.
Thank you, Dave, so much. And good afternoon and good evening, everyone. Thank you so much for joining the first live virtual session of the COVID Advocacy Exchange. My name is Cathy Traz, and I'm Executive Director of Global Advocacy at Bristol-Myers Squibb, and I am thrilled and honored to welcome you here today. The global spread of COVID-19 is affecting each of us and the communities in which we live and serve in different ways, and we recognize this is a challenging time for everyone. As part of our continued commitment to patients worldwide, Bristol-Myers Squibb, we've been going and communicating with many of the global patient advocacy community groups. Many you will hear from today. We want to understand how you're being impacted by the current crisis and what resources are the most needed in order to fulfill your missions. Based on your insights and recognizing the urgency for the global advocacy community, Bristol-Myers Squibb and our digital health partners at Grit Health are today launching the COVID Advocacy Exchange, a virtual platform to unite advocacy organizations, patients, and industry leaders in the exchange of information as we navigate this pandemic together. Thank you again for being part of the first session. This new entirely virtual platform exists to bring together advocates such as yourselves to synchronize efforts, facilitate resource sharing with each other and with patients and affiliates, and to allow for increased collaboration both now and over the long term beyond COVID. After today's session, we encourage you to explore the platform where you can access COVID-19 related materials from Bristol-Myers Squibb, other advocacy organizations, and even third-party advocates through the on-demand virtual exhibitor space. The live meeting area will host weekly live interactive sessions similar to today's, which will also be recorded for future use if you can't make one. Now more than ever, in the face of the challenges constraining time and resources, it's critical that we learn from and support each other across the areas. Together, we really hope to build and enhance the COVID Advocacy Exchange over the coming months in collaboration with you, our advocacy group partners, to create a lasting coalition and platform that will exist for the long term and cover critical topics beyond COVID-19. Thank you again for joining us today and for this inaugural session of the COVID Advocacy Exchange. Now I want to turn it over to my colleague and friend, Catherine Owen, Senior Vice President and Head of Major Markets at Bristol-Myers Squibb, who will be moderating today's panel discussion. Catherine?
Thank you, Dave. Thank you, Cathy, for the warm welcome and introduction. I'm really grateful to be here to moderate the first of our COVID Advocacy Exchange sessions and to hear from all of you firsthand as we take this first important step together. We're really excited and humbled by the response we've received so far from all of you and learning more about all the work that you're doing to provide continued support for your communities during this unprecedented time. Personally, I'm here in New Jersey today, but as you can probably tell from my accent, I'm not native. I'm from England and my family is an ocean away. And I've been worried about them through this pandemic. My father's affected by Alzheimer's and is in a home right now. And so I've been really worried about his situation and how his carers are helping to keep him healthy during these unprecedented times. So I'm sure we're all worried about different members of families, friends, our communities. And we're certainly, as people say, all in this storm together, but I know we don't all feel like we're on the same boat. And so as we come together today as carers, as patients, as family members across the many different countries from around the globe, representing all our different communities, we really want to hear what are the most pressing issues facing you and your patient communities. We've got a great opportunity today to share, to listen, and then hopefully to act together. And with that, I'd like to introduce our panelists who are going to help us have the discussion today and give them their own individual introductions. So first of all, we have Wayne Eskridge, and Wayne is the CEO and founder of the Fatty Liver Foundation. As a result of his own experiences with liver disease, Wayne recognized the acute need for resources and works to address, educate, coordinate, and support victims of this growing epidemic of fatty liver disease. With Wayne, we have Seth Ginsberg. Seth is the co-founder of the Global Healthy Living Foundation. After becoming a health advocate at the age of 13, when he was diagnosed with a form of arthritis, Seth has become a thought leader and social entrepreneur in the global healthcare conversation. And Seth cares passionately about improving the access to healthcare for everybody. Then we have Gary Nolan. Gary is the managing director of the Scientific Education Support, which provides credible disease education in areas with unmet medical need, ensuring people have open access to the latest support through science-driven global initiatives. Gary's based out of London, and he champions education through collaboration and guiding his communities towards working together for the greater good. And finally, we have Andrea Vassilotti. Andrea is the Director of Partnerships and Programs for the World Heart Federation. She focuses on the vulnerable populations in the global fight against cardiovascular disease, and Andrea helps build bridges between industry and international organizations, where she helps to secure funding to reduce the impact of cardiovascular disease. So those are our amazing panelists here with us today. And as they start to introduce themselves, I'm encouraging you to put questions into our chat. The GRIT team will be moderating those questions and making sure that I ask them for you. So please feel free to start doing that now. But I'm going to ask each of our panelists to share a little bit about why they're excited about today. So Wayne, perhaps I could ask you to kick us off.
Oh, wow, thanks. It's only fair that I get to be first here because I'm really old. And, you know, when we think about the fact that this virus is so deadly to people with pre-existing conditions, you know, my group, which is basically the liver disease, the cirrhosis, the people that are dealing with obesity and frequently older age, we are really the bullseye as much as anybody, because we have more we have more comorbids than most people. So I'm really interested to be a part of this because I look at this group, for example, and I see all these vital younger people that are putting so much energy into advocacy and outreach to patients and the whole concept of public health, which is something that we really, really care about. When I started this, there wasn't any advocacy for NASH, which is the term for the type of liver disease that comes from fatty liver. I felt that just to save my own life, I had to become an advocate and to reach out and try to get better information. So what we do is we try to provide information and support to people, because one of the things that I found with my situation was there was lots and lots of information and so much of it was just crap. You know, it was really poor. So we hope to provide curated information where people that really know what they're doing are telling us, and we try to translate that into something our patients can understand.
Thanks, Wayne. That's really great. Awesome. So let's hear about Seth and what his foundation does, and why you're excited to be here with us today, Seth.
Excellent. Well, greetings to everybody around the world from Mount Pocono, Pennsylvania, in the Pocono Mountains, just west of New York. My name is Seth Ginsberg, and I wanted to first and foremost thank BMS and Grit Health for bringing us all together, because that really is why I'm so excited to be a part of this, is because we all have to come together for our mutual and individual survival. And further, and hopefully, and this is the optimist in me, are thriving as a result of the opportunities we as an advocacy community have to mobilize, to galvanize, and to hopefully be as healthy as possible now and well into the future. So it's hard to see the silver linings in a lot of this, but it is an opportunity for us to literally worldwide come together to get through this. And so Global Healthy Living Foundation, GHLF, is a nearly 20-year-old patient advocacy organization that has the mission to improve access to care for people with all chronic conditions. We too, a lot like was just spoken, felt vulnerable and were at high risk for complications early. People with autoimmune inflammatory conditions like rheumatoid arthritis are in also the bullseye. And so GHLF saw itself as really digital first responders very early in this process, and coming to the table to both provide information and support, but also get answers to questions that so many patients within our community had. So I look forward to sharing a little bit more about that, but I'm mostly, Cathy, so excited to be here because while I wish we could be in the same room together and maybe have a meal before or after this, I hope to one day in the future, and in the meantime, we could use technology, which is our friend, to bridge that gap right now.
Thanks, Seth. That's awesome. I wish we were with you in the Poconos. It looks delightfully sunny right now. So I'm now going to ask my friend over in London, Gary, I know they're enjoying some nice weather, to share a little bit more about how he and his advocacy organization are looking forward to today, and share a little bit about who you represent, Gary.
Thank you, Cathy, and thank you, Dave, and Cathy as well for the introduction. So I am calling in from sunny London, which makes a change. Why I believe this forum and today is really important is that over the last 8 or 9 weeks, we've all been put on this journey that we didn't really have much say so in, and we've been all expected to participate in a learning curve that we didn't see before us, and we are having to learn very quickly with. There's no manual for managing and piloting COVID-19, but we're all having to figure out ways and means to cope with the challenges that are presented to us. And with the company that I represent, SES, we're very fortunate to work across many different disease states, supporting many fantastic different patient organizations and professional organizations. And one of the common trends that we're seeing is that everyone is on the same journey. Everyone is having to embrace new approaches to the way that we live our lives, embrace new ways that we support the patient communities that we represent. And in speaking with all of these different communities, we are seeing lots of common trends. And I think with forums like this that BMS is putting together, it allows an opportunity to share those challenges, discuss potential solutions to those challenges, and support patient groups that we wouldn't necessarily think that we're supporting or could support. So the reason why I think this, and I am excited to be a part of this, is it's the first opportunity that I've really had in the last 8 weeks or 9 weeks to share my insights and the groups that I work with insights in a quite a broad audience, because I'm sure that there's lots of learnings that are transferable, and there's lots of things that we can uncover and do better with by knowing that there's others sharing these challenges.
That's something. Gary. Thank you. That's an awesome way to introduce our panelist to Andrea. Andrea, I know you represent patients with cardiovascular disease, so I'm hoping you can give us a little bit more insight as to why you are excited to be with us today. So Andrea.
Thank you so much. Andrea Vassilotti, calling in from Geneva, Switzerland, where the sun is about to go down. So a little bit different from where most of you are. And of course, cardiovascular disease is the most common cause of death in the world. It claims over 17 million lives. But you know, there are really treatments and cures for most aspects of cardiovascular disease that are available, but unfortunately, those solutions are just not getting to everyone. So rather than talking about death, we need to talk about life and hope, and patients are key to that. That's the only way. And I think the cancer community has mobilized public opinion, and we need to do something similar in cardiovascular disease. So that's why I'm really excited. The World Heart Federation is based in Geneva, Switzerland, because the World Health Organization is here as well. And we also so we have 200 members all over the world. And really part of our mission is to translate complex science into policy. And that is something that, going from, very technical, clinical types of information to something that everyone can understand. And I think that's what we need to do to make the messaging simple and really unite the community around this extremely important cause to save lives.
Thanks, Andrea. So those are our panelists today. So depending on the community that you're representing and that you're interested in, please feel free to direct questions to them or to me, and I can ask them on behalf of everybody. So Wayne, I'm going to come back to you, and you were just talking to us about all the different patient groups that you represent with different types of liver disease. And I know you have a passion for patients with chronic diseases having access to proper healthcare. So maybe you can share with the group how you've been helping your community during the last couple of months during COVID, and whether you've had some specific, things that worked really well with your patient community that you could share with the other patient communities here online. So what have you been doing for your fatty liver patient community?
Well, thanks, Catherine. We all face this same challenge because this fuse has been so short and it's come upon us, like a thunderbolt. And just trying to understand what people need, what can benefit them has been a real challenge for us. We've really tried to gather expert information and to repackage it and to put it in our site in a form that we hope helps people, and to give them a place where they don't have to search through a lot of things to find useful information. So I think that's really tough because the information has changed so much, as we go through this. I mean, just think about it. It was no masks. Masks didn't work. Now it's masks everywhere, every day, all the time. It's the changing environment that is partly responsible for causing people to have such unsettled feelings. I mean, we live under threat. People with disease, life-threatening disease, live in the threat of death. So that's not a new concept, but we like to think we understand what those threats are, and so we're trying to make that fear level diminish by providing the information, and we've been more or less successful. Later, I can talk about where we're headed with some of our other things, but that's been our immediate response to this crisis.
Thanks, Wayne. So you've been kind of packaging information in a way that helps your patient community find it easily. Seth, you represent a really broad range of patient groups with different types of autoimmune disease, chronic disease. What have you been doing differently, and what's maybe worked for your foundation?
So the team realized early that it was because of our work, we were going to manage the stress of this situation. And if we're not going to sleep at night, we may as well be working 24 hours a day, which has literally been the situation for the better part of 3 months now. And what GHLF has done is create order for and with patients who are at risk. And we, like I said, engaged early and have been engaging very often throughout the arc of this pandemic. We became the primary source of information for immune-compromised people, being very responsive to the patient concerns across our site, ghlf.org and creakyjoints.org, through our social media channels, our email communication, and our patient councils. We've been vocal, we've been getting answers to questions that patients have, and we've published already nearly 150 pieces of information, resources, articles across about 19 chronic conditions that really rank, I shouldn't use the word rank, but account for the highest risk disease categories or conditions, which, as Wayne mentioned, are our co-conditions. And we updated them. We've been updating this information regularly. We created a patient leadership council with folks who represent individually all those 19 chronic conditions that are high risk patient populations. And this leadership council is allowing us to keep close eyes and ears on patient concerns. And these are the folks who really lead the organization to addressing these. Their concerns, just to name a few, which I'm sure are some shared experiences, are around race disparity, now the reopening of economies locally and nationally and globally, and the getting back to work issues that so many folks are facing. And we communicate with the patient needs to legislators, both here in the US at the state level, having engaged with every state legislator in 27 states already. We'll have all 50, but it's 50. And then, of course, members of Congress and the Senate in Washington. And lastly, and not least of all, we created an immediate patient-centered research registry, which is longitudinally now allowing folks to track over time, how they've been affected by COVID-19, both from a viral infection standpoint, as well as mental health and other patient-reported outcomes. And we're pleased to have very efficiently worked with the Patient-Centered Outcomes Research Institute partners and collaborators, research institutions across a number of chronic autoimmune, inflammatory, and systemic conditions like MS, vasculitis, Crohn's disease, and of course, autoimmune and inflammatory arthritis. So in sum, we've been communicating very early, very often, and very delicately. I mean, really, like very much aware of the sensitivities that the humans that are experiencing this, all of us are just humans going through this, but recognizing the vulnerabilities and the sensitivities of our patient communities to let them know, and this is kind of the overarching message to our communities of patients, is that they're not alone. And this is a very difficult time, but we're going through it together. And as I said in the beginning, we're gonna come out of this hopefully a little bit better than we went in. So we gave our community a community during this time, and I'm just sorry for the circumstances, but I'm really proud and honored for the opportunity to do it and to share those experiences with you today.
That's an amazing accomplishment list that you've just shared with us, Seth, and really interesting in terms of the longitudinal patient registry. I'm sure that will be really useful over time. And I know, Gary, you're passionate about scientific exchange and data, so maybe you could share with us a little bit more about what you've been doing with your community, and if there's anything else that you've found that has worked during the last couple months.
Yeah, so I think that broadly speaking, there's been four areas where we've been really trying to help different groups continue to move forward during this time. The first sort of major activity that we've been supporting is around information, and firstly helping identify credible information at this time. There's lots of information that's being shared. We heard about it a moment ago from some of our panelists around wearing face masks and not wearing face masks, and different communities that may be susceptible to COVID versus others. So really helping identify credible information that can really support patients and patient groups in a meaningful way has been a big task that we've been supporting many groups with. And then once we do find that valuable information is then translating it into several languages. One thing that we've started to experience is that different governments around the world are responding to COVID-19 at different speeds, and the release and distribution of data and information isn't at the same pace. That's not to say that all the information is the same in each country, but there are similarities. So identifying information that's valuable and credible, and then translating it and making it easily as accessible as possible has been something where we've seen a real need for support and welcome support as well. A second very sort of practical aspect where we've been helping empower patient groups is supporting them embracing new approaches to day-to-day activities. So for instance, just having access to things like WebEx or Zoom or different technology platforms that allow you to continue to do your day-to-day activities in a virtual environment so that they can continue to communicate with their patients or carers. And the same applies for professional bodies as well. Just providing really simple access and resources and guides to help people embrace technology that is proving very valuable at this time. So that's a second thing that's really we found very beneficial to the communities that we're supporting and representing. The third thing is reminding the groups that we work with that COVID-19 is a hot topic at the moment. It is commanding a lot of our time and our thinking space, but we do need to continue to think about patients and the fact that there are still patients being diagnosed with rare, difficult to treat diseases. Patients still continue to die from these rare and hard to treat diseases. So we need to continue our activity and our day-to-day commitments as an advocate or a professional group. So just reminding people that it's still okay to raise awareness of your disease amongst COVID-19. The limelight is already on COVID-19. We don't need to worry about taking the spotlight off COVID-19. So important to continue our awareness, general awareness, signs and symptoms type activities during COVID-19 as well. It's something that we've helped and continue to support our groups with. And then the last thing that we've really been doing is expert opinions. Now, we've been very fortunate enough to have a great network of doctors that work across hematology and oncology that have been dealing with and treating patients with compromised immune systems during COVID-19. We've been working with doctors in some of the hardest hit areas of Italy, across France, across Spain, and all across the US and South America as well. And working with those doctors to elicit their experience and their frontline opinions and approaches to how they're managing these situations, and then providing them back to the communities that these doctors represent through patient groups has also been something that's been very well received. So getting really first-hand experience from the hematologists and the oncologists treating these really difficult to treat diseases during COVID-19, and then sharing their insights amongst the community.
Thanks, Gary. That's excellent. You've really been focusing on the key areas it sounds like that your patient communities are finding important. And so, Andrea, as we turn to you in Switzerland and the patient community you represent with cardiovascular disease, maybe we can pivot slightly with the question. And I know you're all passionate about your patients maintaining their access to healthcare during COVID-19. While we're all required to stay at home, we've been thinking through, or you've been thinking through, how your patients should continue to access healthcare. So as well as anything that you might have done differently than what our panelists have just shared for your community, maybe you can talk about how you're encouraging your patients to continue to access the very important healthcare that they need.
Yeah, absolutely. So we've really felt that the communication space has been dominated by COVID-19. It's everywhere, as it should be. But of course, there is, with confinement, people are staying at home. I know more than a few of us have gained a few pounds. And, maybe, confinement and healthy living are not synonymous. So some of the efforts that we've made are to, through our World Heart Day communications platform, is to really recognize the pandemic. So we've launched an animated banner. We've decided to theme the event Use Heart with the emoji or the heart symbol. Use heart to fight broken heart, or use heart to fight heart disease. And we're having like healthy tips, how you can exercise or how you can eat better, or prevention is extremely important. So I think what we're doing is, rather than being, and I think Gary was speaking to this as well, some people feel, oh, we can't talk about our disease, because we'll sound sort of heartless, people are dying from the coronavirus, but it's actually sort of the opposite, because we have been seeing that in some places there have been a 50% fewer people coming to emergency rooms, for example, with suspected heart attacks, simply because they're afraid. They're afraid to go to a clinic where they might contract the virus. So I think we need to continue to inform people that they must, take precautions, but take care of their hearts most of all. And that is also why actually the World Heart Federation, for the first time in many years, is actually undertaking a global study on COVID-19 patients and cardiovascular disease risks, because it seems that we are much more cardiovascular patients, and people who have the risk factors like hypertension, like atrial fibrillation, are much more vulnerable to the disease. So very, very important not to let our guard down.
Thanks, Andrea. Yeah, absolutely. There's lots of different information out there right now about cardiovascular disease and its effects, cause or effect on COVID. So really interesting that you're kind of continuing to drive that from your perspective. Wayne, you mentioned earlier that your patient groups were maybe somewhat older, depending, and maybe somewhat more vulnerable to COVID. And I know that those patients particularly are also scared about accessing healthcare. Have you done anything differently with your groups to help or encourage them to access healthcare, maybe using telemedicine or anything differently like that, in terms of different ways to continue to get that vital healthcare that they need?
Boy, that's has been a tough one, because it's got two sides. The patients are fearful, and so they do sometimes not visit the doctor when they should, or they skip appointments, or they don't get procedures by their choice. But we also see the other side, where the system has not yet become robust in terms of handling those people. And so we have people that are trying their very best to do the things that they know they should, and their doctors have told them, and then yet the systems are closed, or the clinics are not responding, or they're scheduling people way out. So the main solution right now is to try to, on the one side, convince people that they really needed to take those things seriously, because statistically, they're in as much risk from some of the things that they are experiencing as they would be if they got the disease. But on the other, we try to get them to try the telemedicine approaches that people are trying to do, to call their offices, talk to their doctors, talk to their caregivers, reach out to their support systems, because avoiding care when you're in a dangerous long-term situation is just not a good thing. And it's a real struggle for people right now, because the level of uncertainty is really high. They have some accommodation with the disease they have, and they have this big unknown as to how risky and how bad COVID is. So we don't have a good solution to that, I think, other than communicating in all directions about not avoiding care for the people that are at risk from all of these other things.
But that's a great point you bring up about the system, depending on where you are in the world, being prepared for remote engagements with patients or not. So Seth, I wonder if you've got any thoughts on this. A lot of your patients are immunocompromised, and so particularly at risk should they be exposed. So have you kind of addressed this issue, or come to any other different conclusions with your patient groups?
Yeah, I think at this point we're taking every day as it comes. And part of the challenge for us is always from the beginning has been like the goalposts keep changing, the targets keep moving, and frankly, information is, bless you, Dave. The information is rapidly evolving, and so our approach has been just to remain on top of this and to offer as updated and as applicable information as possible, because that's the other thing. Just majority of outlets, traditional media channels, outlets, and other forms of communication don't necessarily speak to the needs of our communities and patients who go through these situations. Look, every flu season, every fall, we've been wearing masks. So many of us as patients. In fact, just to not overshare, but this past fall, the team had discussed the merits of us creating like a little branded mask program that we would give away. And when I think about things that I regret not jumping completely on and having, potentially totally missed the boat on that, that's one of them. But it speaks to the fact that these have been, kind of recurring challenges that our patients have faced, just helping the world understand like good hygiene through an airport, and what it means to travel and stay healthy and not to infect each other. And so, the stakes are a lot higher. The situation is a lot more dire, and at the same time, we think that that's also an opportunity for us to, like I said before, kind of galvanize and use this opportunity to the collective's advantage.
Thanks, Seth. And I think quite a few of our attendees have been asking about your registry, and I noticed that we've got the website of that up now in the chat. So those that were interested in Seth's registry, you can scroll up and find that, autoimmunecovid.org. So that'll be really interesting, I know, for a lot of people. So Gary, in terms of communication during the COVID crisis, we've heard about access to healthcare. We've heard about different types of information. How about helping your members find the right information specifically for their diseases? Is there anything you've done differently? And also maybe a pivot into mental health. How have you been helping your groups find more access to good mental health support should they be feeling differently or down about the situation right now?
I think it goes back to the previous question around credible information. There's so much information happening sort of being released at the moment. It's about identifying the credible information and making that as readily available as possible. I don't know if it's globally, but here in the UK at the moment, it is Mental Health Week. And there's been some tremendous campaigns that I have seen globally, where there's these very well established groups, advocacy groups around mental health that are doing fantastic activities. We're not directly involved in them, but fantastic activities in supporting patients. Well, not just patients, just supporting the general public around mental health. So where possible, we've been, letting other groups know that these initiatives are up and running. They're providing support from a mental health perspective, and literally just over communicating to our groups that these resources are available for them. I think as well, just Cathy, coming back to your thing about communication, something that, and it builds upon Andrea's point as well around the 50% decrease in admissions from suspected heart attacks. The communication that we've been seeing over recent weeks and months around stay at home was the appropriate messaging to manage the peak or spike of COVID-19, and in doing so, we've managed and flattened the curve, as they say in the UK, around the spike in hospital admissions during COVID-19. But what we now are starting to see is the downside to that stay-at-home message, the disadvantage to the stay-at-home message. So one of the groups that we support, the MDS Alliance, consists of about 33 member groups globally. And something that very quickly came to fruition a couple of weeks ago was about 70% of MDS patients are anemic and therefore depend on transfusions. And there's a huge blood shortage at the moment because of this messaging and communications around stay at home. We're also seeing similar situations around patients with for stem cell transplantation. So we're seeing it's now about managing, from my point of view, it's about managing that communication of stay at home, because we need to be communicating to communities that support patient communities, that we need to find ways and methods to reintegrate into community to be able to give blood for the 70% of patients that are anemic, for instance, in MDS. So it's, going back to your question at the beginning about the information, I think it's about changing the communication message now, but doing it collectively as a community. So there's shared or there's alignment. So, in hematology, where there are, many malignancies have anemic side effects, it's about finding safe ways to get more blood donors available and coming out to do so. But once again, that comes back to my first point of driving people to credible information. So if the governing bodies, the governments themselves can start to think about the impact of what the actual impact of stay at home is, and how we can start to overcome that in a positive way, I think that's going to be really important as well moving forward.
Yeah, that's great. I think that the lack of blood for that patient group or those patient groups is really concerning, obviously. So there's a lot of interconnected issues going on. Andrea, I'm going to sort of pivot a little bit into the patient organizations as a whole, and we've had a question that came through on the Q&A from Alex, and it was, do we anticipate that our role as patient organizations will evolve in how we interact with key stakeholders in the new norm? And is there anything that we can do today to collectively prepare for this sort of new way of interacting in the new world? I'm sure you've got a perspective from your point of view.
Yes, well, I think today's discussion is very, very demonstrative of that, because, of course, maybe a few months ago we would have done this as a live panel, but it couldn't happen live. So I think that, yes, we need to be sharing and collaborating like we are today. But I think one of the difficulties is that many of the, say, scientific organizations, even patient groups, they live off of their congresses, and many of them have been canceled in 2020, which will mean that there's, the organizations are losing an important part of their funding base this year. And also, I think, many of the patient groups that are living on donations as a nonprofit organization are seeing donations are going down, because there's just an economic impact. People feel the weight of the uncertainty. Maybe they're losing their jobs. Older people can't get to the post office. So I think that we're going to see some difficult times for the next 18 months, because this crisis will continue through 2021, although, God willing, I hope that we won't be seeing as much impact from the virus, but the economic impact will undoubtedly continue and be felt. So I think what's really important is that we are able to collaborate. That's one thing that I think a lot of times there are territorial issues between different patient groups. People don't always get along, but we're a global organization, and we try to unite the community as much as we can. And I think that we will find that is even more necessary, to collaborate, to maybe share funding, and to really engage together on projects. So that's one thing that I think will change us. And I think that face-to-face networking is irreplaceable. However, we may need to do that in a different way for a while. We may need to do it in smaller groups, but I think that it is also important that we can continue. But platforms like the one we're using today to bring together the patient voice is great and is a wonderful way to address, and it's something that we'll be using more in the future.
Thanks, Andrea. Wayne, as the founder and CEO of Your Patient Foundation, are you concerned similarly about this inability maybe to raise the same amount of funding or to network? Like, how is that affecting you and your team? And then maybe Seth, you can give us some thoughts after Wayne.
Well, we're going to be like a lot of nonprofits in that we have projects going forward that have simply gone away. We're a little different than many because we live with the patient. We're down in the mud and the blood where the people are, and we can't have contact with those people now. So all of our projects that had to do with direct patient support and contact and testing have just simply been stopped. And the funding that we anticipated for those kind of things, we have no idea how that might turn out in the future. We've seen funding for outreach about our specific disease population being cut back. So the world of advocacy that is supported by that is part of a nonprofit or doesn't have a business income kind of support is going to struggle now. And we're in a position to probably weather this, but I know of a lot of little nonprofits that are probably going to barely hang on because the attention has shifted and the uncertainty of businesses about their own situation has changed so much that the outreach that they might have wanted to do, they don't feel confident about. So the next few months are going to be critical in that. And I think as advocacy groups, we need to try to communicate with people, with those organizations, the funding people, to remember, we're doing important things out here, and if we go away, it's going to leave a big hole in the future that we're going to have to come back and somehow figure out how to fill. So it's an attention thing, and COVID has all the attention right now, and it's really disturbing people's planning cycles.
I can only imagine what it must be doing to planning cycles and funding for the future. Seth, I wonder if you've got any other thoughts to share about that, or whether you've been doing any specific lobbying with state and federal, as you had mentioned earlier, to try and secure different types of funding and give other advocacy organizations some different ideas.
So we haven't been lobbying. We've been advocating for increased funding for various community and national and regional organizations. GHLF is structured a little differently in that we don't accept donations from individuals. We don't do fundraisers. Our funding comes from various company sponsorships and grants throughout the healthcare sector, as well as government research grants and awards, and private institutions or third-party foundations that support our work. And so as a result, this isn't necessarily our issue, which has actually enabled us to, and the reason we've been so focused on all the other needs that the organization is well suited to address. To your point, allowing for government to recognize the importance of funding these types of patient population efforts and understanding their needs. But then really thinking through the cascading challenges that this is causing. I mean, it's no secret people at home are less healthier. I think someone mentioned earlier. I just all of us have probably haven't been as healthy as we could be. And as a result, you know, that really does have an adverse event on our health writ large. And so we're thinking through all the ways that we can address this, because the impact is on the wallet, but it's also on the rest of the body and the mind and the spirit. And you tie all those things together, and it's a perfect storm of not good. You know, not to dwell on the negative, but to see this as an opportunity to address, you know, many of these issues within the means that we as organizations have for patients in need right now.
Thanks, Seth. Gary, I don't know if you've got any different thoughts, but one of our attendees, Elizabeth, is saying that we should use this opportunity to show policy decision makers the important role of the patient organizations, which are actually filling gaps in many of our healthcare systems globally, which I think is a great point. Any thoughts on that or around this subject in general?
Well, I think.
Oh, sorry.
Oh, sorry. No.
Why don't we have Gary first and then Andrea? I'd love you to add on. Yeah, thanks.
Well, I can only echo what I've heard from the other panelists. I was on a call today with a couple of patient advocacy leaders who made me aware of a survey that's been circulated amongst many patient groups, and 60% of non-for-profit patient groups have said that they will be in financial trouble in 3 months' time if nothing happens. 60% of non-for-profit group. I was amazed that, you know, I mean, I'm not surprised that it's that significant, but it's scary how significant the impact is. And I think if government bodies and organizations don't do something to support that, it's going to, as Seth said, it's going to be a really, really difficult situation. And then on top of that, there's sort of constitutional regulations in place that state that non-for-profits can only have so many reserves available for them for so much time, up 3 months, 6 months in some countries. So if we don't do something to support that and change those sort of constitutional laws and regulations in place, it's impossible for some of these groups to survive. And we need to find ways to work as a community to overcome those challenges. But I do have at the end, if I have time, I might have a positive story to share. But I'll let Andrea speak first. Sorry.
Yes, I just wanted to say that really what patient groups need to do is to, as much as they can, demonstrate their ability to strengthen health systems. I'm talking about really simple things. You know, it could be, you know, some of the projects that we've heard about, you know, measuring hypertension in a barber shop, and just keeping that under control. And I think still with the pandemic, it's something that we can do because those businesses are starting to open, and we really need to demonstrate how you know, community activities can really help put a dent in the disease burden.
That's great, Andrea. Thank you. So Wayne, I was going to invite you just to share any thoughts that you have right now about any of the other communication issues that we may not have touched on already for your patient population, in terms of how we can continue to support them or even work together with other groups.
Well, we're in a kind of a unique spot, I think, for collaboration, because it's not generally felt, but the liver is biochemically tied in with all of these other diseases, and so we're able to collaborate with almost anybody with a disease situation, and we're very much open to finding collaborative ways to reach out to patients, because almost all of our patients have more than one problem. I mean, it's not a single disease situation. So I think that this effort to provide tools that we can collaborate and we can find common ground and common ways, I think is really critical. I don't know that I have an answer for what that should be right now, but I think this is a beginning of those kind of tools, and I'm really pleased to be a part of it.
Thanks, Wayne. I'm going to throw this out to the panel, and I guess it's the first one to speak that gets to answer first. We'll see how it works. But we've had a question from one of our attendees, Kawaldip Sami, so thanks, Kawaldip. And the question is, do we now need a new global framework for patient engagement in the public health crisis of pandemics, as current frameworks seem to have failed? So anybody got any thoughts on a new global framework for patient engagement?
I can't go to global. I can hardly get out of my neighborhood. I think we need some thought and some effort at that scale, but I can't get it. I can't get out of the neighborhood that we live in, really.
Yeah, the only thing I can add is that the World Health Organization every year holds the World Health Assembly. It took place this year in an abbreviated version, only for a day and a half. But it was they adopted a global resolution on COVID-19. However, you know, these global resolutions or frameworks tend to be, you know, it's great, but it doesn't mean anything unless we adopt it on a local level. So I think we really need patients to be very connected to their governments, to all of their stakeholders, and try to have an ambassador, you know, a disease ambassador in each country. I think we need to think globally, or be global, but particularly think local, because health systems are national, and that's how problems will be solved.
That's very true. Seth, any thoughts on that?
No, not. I mean, I think it's been well addressed.
Okay, Gary, I don't want to cut. If you've got any thoughts, or we can move on to another question.
No, I completely agree with Andrea. I think you know, the appointment of country representatives that can feed into global representatives sounds like a sensible model to try and establish a global patient voice in the management of COVID-19. Obviously, there's so many diseases that sit within in and around this. So, but I think something needs to change personally, especially from a communication perspective around COVID-19.
Thanks, Gary. So let me pivot a little. Andre, you're sitting in Switzerland in the middle of Europe and next to the World Health Organization, and I'm sure there's a myriad of different government ideas sort of swirling around. Is there anything specific that you at the World Heart Federation are looking to drive differently in the next few months for your patients in terms of trying to engage or direct any of these conversations?
Yes, well, we're trying to be very conscious of our members, who are often patient groups and foundations, and checking in with them, seeing how they are. And it's been quite interesting for me to be talking to people in, you know, I have on my list of members that I'm responsible for, people in New York City, people in Cambodia. Now, I was really surprised to see Cambodia, for example. They have very few cases. I think they had 3 cases of the coronavirus, but they have huge economic impact because a lot of the big brands, you know, produce their clothes there. So, you know, there's been kind of a very mixed impact, and we're seeing that people need, I think, very different solutions because of that, and you know, it's going to be hard, you know, getting out of this, because we're all getting out of it at different speeds and trying to be very vigilant because the next wave may come. So you know, I think now more than ever we need to really follow the guidelines that our national governments are giving us. And, you know, if we don't feel that's right, lobby the people, the powers that be, because, you know, we really need to take the local situations into account.
Thanks, Andrea. Any other thoughts on our panelists on that question? No. Okay. Well, Gary, please go ahead, Gary.
Well, I think it builds upon Andrea's point and the question around changes and what we can do differently. Something that that I spoke about this week, which was very interesting to me. We work with a group of patient advocacy groups in cholangiocarcinoma, which is a very rare type of bile duct cancer. Very a devastating disease, highly under-recognized, and a tremendous unmet need. And particularly in Southeast Asia, we know the cause of the disease. So it's more around prevention. And the cause of the disease in Southeast Asia is around liver fluke, which is caused by eating raw fish. So it's very much a cultural a cause of the disease. In other parts of the world, we're not really too sure what the cause of the disease, whether it's pesticides or so forth. But in Southeast Asia, we're fairly confident that the cause of the disease is liver fluke caused by eating raw fish. And so very culturally driven. But the positive of COVID-19 is that it's forced these communities in Southeast Asia to stay at home. So they've had to culturally change the way they live their lives. And what these groups are doing in Southeast Asia at the moment is they're using and drawing comparisons to the way that these way that the general public has to change their lives to stop the spread of COVID-19, and saying, well, you've been able to do this to stop the spread of COVID-19. Now use that experience to try and, stop eating raw fish that will prevent cholangiocarcinoma. And it's the same with other lifestyle diseases as well, very much like Wayne and some of the liver diseases that we get from from alcohol-induced liver diseases and things like that, and some forms of lung cancer, where if we can draw comparisons to how we've had to culturally change quite quickly to deal with COVID-19, and can draw comparisons to how we can change our lifestyle in other ways to prevent other diseases, I think there's a lot of shared learning that can be taken from this in a very positive way. And I think governments could and should look at that, about how we can take the learnings about how we change our lives very quickly and very abruptly to deal with the disease, and how we can take similar approaches to dealing with these other diseases that are caused by lifestyle decisions.
That's a really great and interesting point, Gary. Wayne, do you have any thoughts on that in terms of your
I think that this does present us with a teachable moment. As difficult as it is, and as tragic as it is, there's going to be a period of time when we can learn new things as societies. And I think that as advocates, it's important for us to think about that, and to think about the messaging that we want to impart down the road a few months, so that this learning opportunity doesn't just go away as people stop being afraid of COVID.
Yep. Seth, any thoughts from you? Because obviously a lot of your patients that you represent, it's not a lifestyle, it's an inherited disease or a genetic disease. So any thoughts from you on the teachable moment issue here?
Yeah, 100%. This is the dawn of what we hope is the fiercest, most effective pro-vax, pro-patient advocacy effort. Full stop. We got to get better at vaccinations. We can do it. We can do it as a society, globally. And it took this random act of galvanization that I hope is to become, I should say, the lightning rod that fuels or energizes this collective advocacy effort for vaccinations for children, for seniors, and everyone in between.
Very well said, my friend. So we've had a question in terms of some thoughts an interesting point that I think, Andre, you raised earlier was around global advocacy, and is there anything we can do as a global advocacy community in terms of working together? So based on what we've heard today, any thoughts on globally coming together with different advocacy groups, and how can we do that most effectively?
Yes, well, I think that there are many examples of it. We've seen it, for example, in, there are groups from people suffering from just a genetic high cholesterol, familial hypercholesterolemia, FH, very, very closely related to arteriosclerosis. So getting those societies together, and we have actually a group on that, we've gotten the scientists together, the patient groups together, and trying to increase knowledge of the disease so that, people aren't dying of heart attacks when they're, as young as 18. So I think there are a lot of ways that we can, the heart is, there's a lot going on there. So that, we're related to all of the other diseases. You have things like pulmonary hypertension, which is, respiratory and cardiac disease. So, there are many, many examples, but there are really ways where we have to work together. And we've done that at World Heart Federation a little bit on a global level with the Global Coalition on Circulatory Health. And we have about 9 organizations, including the International Council of Nurses, but all the disease areas to come together to, the World Stroke Organization as well as part of that. To bring this kind of multifunctional message together. And I'm sure that all of the groups present here today on the panel, there are similar coalitions that can be built. And maybe that's really the way to go to really address the various challenges around these diseases, and really giving people hope and quality of life.
Awesome. So I'm going to ask our audience if there are any other questions, but as they do that, I'm going to ask each of you, we've been speaking for about an hour now, to think through kind of the theme that you've heard most today in terms of what's uniting us, and maybe something that you're interested in talking about next time in addressing within this forum. So Wayne, I don't know if you want to start, but what's the thing that's kind of struck you most about today's conversation, and where's an area that you'd like to see us explore further in the future?
Wow, synthesize this group.
You can have a go.
I have to give praise to Dave, because he's brought together a really interesting panel here, and I think that the range of ideas has been really quite interesting. I think I come away with things to think about longer term. I think that we all are doing somewhat the same thing. We're all responding to this fire that's burning our house down right now, because it's only a few weeks old, and so we're still all reeling from that. But I really sense that everyone has their part of their mind, at least, on next 6 months and the year after that, and how do we as public health advocates, and fundamentally that's what we are. We're disease focused, but we are public health advocates. And I think that this is an opportunity, I think, to explore the synergy that takes place between all of these disease can build a stronger message to governments and industry about being really caring about patients. You know, it's one thing to talk about as a liver or a heart or whatever organ is your favorite. But when we go to talk to governments and we talk to agencies, they have to really grasp the idea that this is a public health issue and that public health is the thing that needs to be fundamentally supported on a broad scale. And that's what I want to work on.
That's awesome, Wayne. Just a small focus.
It's a small chart.
Seth, how about you? What do you think? What struck you about today's conversation, and what do you think we need to work on together?
Great, yeah, and thank you for including me for sure, and GHLF in this really exciting opportunity to continue this. I mean, I see this and I know we've been clear, this is just the beginning of this bringing together of all of us for these shared purposes and these experiences. But to pick up on what Wayne just said, it is all about public health. And where we got to take this, I humbly submit, is using our powers for good, and in doing so, elevating and allowing science and medicine and epidemiology and the people that really do know about this stuff to have the share of voice that they don't just deserve, but they absolutely need right now. And we have to give that share of voice to the public, to the policymakers, to the regulators, and of course to our constituents and our communities and our patients. And it's not going to be easy, and there are a lot of challenges here that we face, but you know, we've officially turned this into a marathon. It is no longer a sprint, although we are sprinting at mile 13. Sorry for using just a US. I don't even know the kilometers, so I'm embarrassed. Anyway, you get the point. So let's pace ourselves, but let's kind of keep this moving because we've got a public health mandate as organizations for our communities, but really for the public. And I think we are the ones most poised to do it. And that's why it's so exciting to be a part of this.
Thanks, Seth. We'll forgive you for the miles to kilometers. I know I struggle between both of those units all the time. Great point about giving medicine and public health and epidemiology the right voice and space to give us all the right messages. Gary, as a person who's passionate about sharing the right scientific information, how about your thoughts on today and areas that you'd like to see us focus on in the future?
Well, first, I'd just like to thank you all for the opportunity to speak. Not being a patient advocate in the purest term, I do work very closely with many patient advocacy groups and patient advocates in many different diseases. And one of the things that has been fantastic about this opportunity and the opportunity that will come out of COVID-19 is that, for many years and since the turn of time, we've always been looking for equality. And COVID-19 is certainly the first time in my lifetime, and I'm sure many others, where we've all been put into the same boat, where we are all facing the same problem, regardless if we're rich, poor, sick or healthy. We are all in the same boat. And hopefully that presents us with opportunities where we forget about the politics and the politics of so many different situations, the politics we see in so many different organizations, the politics we see in so many governments, where we can put those to side for once and actually do the right thing when it comes to public health and really think about what is important for public health and sort of avoid the politics that delay so many important decisions being made. And using these learnings to actually make a positive change, from policy making through to advocacy, through to, better access to other therapies, because I think this opportunity allows us to be all equal and actually sing from the same hymn sheet for once, if it's very well managed. And I completely agree with Seth in the fact that this is a marathon and it's going to take a long time, but it's a very grounding opportunity to put everyone into the same boat and sing off the same hymn sheet.
Thanks, Gary. So Andrea, your final thoughts in terms of things that have struck you today and maybe areas for the future for our focus.
Yeah, so I think the global public health message, and we're seeing it, we have to, we have a lot in common. We're all in the same boat, of course, as Gary said, but I think we're not affected in the same way, and there are many vulnerable populations who are even more vulnerable now. Yeah, we really need to find ways to address equity and make sure that everyone has access to care. So that's really the biggest challenge, and it's more than that 26 kilometers or 26 miles marathon. It's going to be a very, very long race to adjust that and to reach a better sense of equity. But I think if we all work together, we can certainly make progress to the goal.
Thanks, Andrea. That's a great summary for everybody. So I'd just like to thank our panelists today for sharing their thoughts and their insights and freely communicating with all of us. And thank you all for joining us. But before we close, I just want to pass it back to Dave for your closing thoughts on today's session.
Wow, thank you, Catherine, so much. Thank you to all of our panelists and attendees. I'm at a loss to try to find words that are sufficient to capture everything, not only that I heard, but that I felt from this, and just really in awe of how genuine and really human everybody is in their focus. Wayne, you are far too generous. As with most things that really move the world forward, this has been a huge, huge team effort. Many people that I've known for years and have helped me become the advocate that I am, and then other people that I've met in the last week or two that are now friends I'll have for life. This has truly been collaboration at its finest. Anytime that I struggle to put things into words, I go back to something really formative in my life. Growing up, my dad's motto, and this has been what's gotten me through my diagnoses and trying to become an advocate and being a caregiver. Growing up, my dad would say to us that the difficult we do immediately, the impossible just takes us a little longer. And I've spent my life living those words. And in moments like this, what I've learned from that pursuit is I would adjust my dad's words to say that the difficult we can do individually, but the impossible only happens together. And feeling what this togetherness is like has taken me from a tough place as a survivor, worried about COVID affecting me and people I love and the work that we're doing. It has been a real interruption, to put it nicely. I think everybody shared the fears that we face, the work that we want to do to continue living our missions and fulfilling our missions. And then what happens after this? What are the new achievements that are possible? What becomes possible because of this moment? And one of my mentors, Jen, said to me in the last week that if we look at this moment for what it really is, it is a moment where walls are becoming bridges. And if we look across all the different groups and all the different advocates and all the different diseases that we work on, and just feel how many of us are here just at the start of this, I can't imagine what will become possible as we continue building this. And so this will be open at least for the next few months. Please tell your friends, share this with others you respect. Anybody can visit this at covidadvocacyexchange.com. It will be open 24/7 now going forward. This video from our session today will be available early next week, so anybody can come back and watch it. There's about a dozen virtual exhibitor booths already that are full of amazing resources, both practical and really strategic things that our organizations are doing. So I encourage you to spread the word about that and invite others to attend. And I'll wrap this together, I guess, by going back to the start for me. We all as advocates have a path, and where that path will lead, we never know. But I feel more alive and more capable because of us being together. And so truly thank you to everybody. I hope to see you all next week and for the subsequent weeks. Please stay safe, stay healthy, and thank you for your authenticity. Cheers.